So there's a case of renal cell carcinoma, a more radiation-resistant tumor. That lesion actually, he was on a trial, did not get radiation therapy as the T8 lesion did. This is a gentleman with lung adenocarcinoma. This is your classic Friday night consult by orthopedic spine surgery. He had refused surgery and radiation therapy. New diagnosis, he came with radicular pain. He was not myelopathic. He had no weaknesses or he had no weakness. So question was, anything you can do? And you can see here he's got 2 lesions at L4 and L5 extending in the canal. Pretty severe canal stenosis at L4, to a lesser degree at L5. And again, you see placement of the probes. I really wanted to use the thermocouplers here because you saw how little canal space there was. Even if not for measuring, I wanted to be able to inject D5W to try to get the best kill possible. And here you can see after the cement, we did an epidural because he had radiculopathy. And that's an aside that, I will tell you, if they present with radiculopathy, there's a good chance you're going to make it worse, especially if there's tumor in the foramina. But even if you do, even if you don't make it worse, often ablation and cement are going to make it better right away. So I'm a big proponent of epidurals or transforaminal epidurals if they have radicular pain. This gentleman, we were able to get post-ablation imaging. These are T1 fat-sat post-contrast. And here you can see that you can see necrosis. This is cement. This is non-enhancement. Then you just see this rim of enhancement here. And if you go in the axial, you just see rim enhancement, but necrosis all the way around. And then down at L5, the same thing. You see this rim, and this rim enhancement is inflammatory. Then it becomes fibrotic. First it's hemorrhagic, then it's inflammatory, then it becomes fibrotic, but all necrotic. And that's what we'd like to see. Do we get it every time? No, we don't, but that is our goal. And then he didn't want to get MRs for me. Somebody asked me, I like to get MRs 6 to 8 weeks. So we used his CAT scans, CT scans, and there was no progression of disease or the canal stenosis. Even L4 actually had a little bit of retraction here of his. And we had to do a couple epidurals after the ablation, but that's to no surprise because of the degree of canal stenosis.